My name is Katherine Gilliam. I am an osteopathic family practitioner here at Gilbert Clinic, and I've been here right at 2 years. Here I'm a little bit different than all the other providers, being family medicine compared to internal medicine. Something people may not know about family medicine is that we're full service. Certainly here we see kids and adults. I certainly do a lot more with kids. I also do a lot more female medicine as well to try to help patients not have to always drive to Bowling Green and get care in Russellville. The vaccines are very important, and we give vaccines here in the office. The number one question is, are they safe? And the answer is yes. They do have side effects, but since the addition of vaccines to our school systems, we've had a 90% decrease in vaccine preventable illnesses. So the flu, polio, measles, mumps, all of our vaccines that we offer. So the age ranges vary on obviously which vaccine we're getting. We start at newborns, and hepatitis B vaccine is given before they even leave the hospital. And then we have the kids immunization schedule. You have quite a few at 2, 4, and 6 months. And then you skip to typically a year and 18 months, and then we're good until 4 years of age, and then we jump up until we're about 10 years old. Now there's certainly adult vaccines as well, and that does not include the flu vaccine, which is yearly, but then we start again with shingles vaccine and pneumonia. Of course, flu is still given as well. The best time of the year to get the flu vaccine really depends on the area. Right now, with no flu being in the area yet, the prediction is going to be end of September to October. If the flu comes into the area sooner than that, which it did last year, then we recommend the first case of the flu in the county. That's when we want to start giving the vaccines. So Gilbert Clinic provides a different opportunity with healthcare in this area. Certainly being here in Russellville compared to Bowling Green, that gives a good advantage just because we can avoid the drive. There's limited amount of providers here in Russellville, and so if we can offer as much as possible here in Russellville to prevent certainly our young kids, our kids in school who are having to take out more time, or even our elderly who have trouble with traveling. If we can provide those services here, then that's always a good thing to avoid the need to travel. What I try to do to make patients the happiest and give them the best results is be the listener. I try to listen as much as possible and to provide as much feedback as much as possible, and also try to follow their care if they are seeing other specialists. I always tell people I treat the older patients like my parents or like my grandparents. I treat all my kids just like my own kids. So I try to definitely put my whole heart and soul into my patients, and I truly care about my patients.